Over the years, MS Teamworks has shared different perspectives on MS from patients, care partners, family members, and healthcare professionals. Guided by our mantra, I have MS, I have a team, I have a future, we are proud to share new messages of hope and inspiration with the MS community.
I have MS.
I'm on your team.
I have a future.
My name is Bob Shin. I'm a neurologist and neuro-ophthalmologist at MedStar Georgetown University Hospital. When I was in medical school, I became interested in neurology, which is really just the study of the brain and the central nervous system. Well, in my neurology training, I was actually really interested in visual perception and how people see things. So humans are very visual animals, right? So I have a dog, he's really all about smell, or some animals have really keen senses of hearing. But humans, we do everything almost visually, right? We read, we watch television, we walk around the world, and we have really, really excellent vision, actually, in the animal kingdom. So in neurology, I would be addressing patients who have visual issues. That's actually what really led me into multiple sclerosis, because, in fact, many young people or people with MS develop vision issues, and in fact, many MS patients report that the first symptom they had of their MS was something that was visual. So the relationship between MS and visual issues is that MS affects the brain and spinal cord, so anything that the brain and spinal cord does can be affected by MS, and it turns out that a lot of what our brain and brainstem in particular control are aspects of vision. The three main areas that I see in terms of patients who are having MS-related visual issues is that sometimes MS will affect their ability to see. They'll complain of blurred vision or loss of vision. Another area, though, is slightly different, which would be patients may complain of double vision, meaning that they're trying to look at one thing, but they see multiple images, and that obviously is very disorienting. And there is a third area that I sometimes see where patients have sort of unusual eye movements, where the eyes are shaking involuntarily, which obviously creates a big visual disturbance for the patient. And really all of this is because MS targets those brain and brainstem structures. I think of vision issues as really just another type of MS-related symptom. So if we speak in general, when patients have multiple sclerosis, they frequently have what we call relapses, right? Attacks, exacerbations, where out of the blue, a neurological symptom will develop. So again, a common scenario would be a person will suddenly develop blurred vision and maybe pain with moving an eye. That's a visual attack. On the other hand, patients may have an attack of double vision. They suddenly can't see well. Talking about vision loss. And that's really the cable that connects our eye to our brain to allow us to see. So when patients develop optic neuritis, we think they have inflammation in that nerve, in that connection, and that means that signals from the eye can't get to the brain. So the person with MS is going to experience vision loss or blurring of vision. A lot of my patients will say that maybe they just thought there was a smudge on their glasses. Then they realize, oh, I'm not wearing glasses. Or maybe they thought their contact lens was dirty. It can be very subtle like that, just a little bit of blurring of vision. They may complain that when they move their eyes around, the eyes feel uncomfortable, that they feel an ache or a little sticking sensation behind the eye. We think that's because when the eye moves, the nerve wiggles, and so that movement causes a little bit of discomfort. So these are the features of what we call optic neuritis. Patients do typically recover, so 90% of patients with optic neuritis will get their vision back. I will say it doesn't always come back 100% though. So many of my patients who have had optic neuritis will tell me, if they compare one eye or the other, they can tell, oh, this eye isn't quite as good. Or they may notice problems with depth perception, like going downstairs, or issues under low light conditions. So these are all aspects of vision loss related specifically to optic neuritis. So MS patients can also experience double vision. And what I try to explain to my patients is that this is because we have two eyes, actually. And normally our eyes work together so that they're each pointing at the same thing, so we just see one world. But because of how MS affects the brainstem, sometimes the machinery that connects the two of them gets broken. so that maybe one eye moves in one direction, but the other eye doesn't come along. So a really classic example in MS is something we call internuclear ophthalmoplegia, or INO. And in that condition, the eyes normally would move side to side together. Someone with an INO, when they try to, let's say, look to the right, this eye might look to the right, and this eye doesn't come along. So this eye and this eye are pointing at different things, so the patient has double vision. One question I'll immediately ask if a patient of mine has double vision, I'll say, well, does it go away if you cover either eye? Because somebody with neurologic double vision, from what we call strabismus, the eyes are not pointing, if they close one eye, they only see one image. If they close the other eye, they only see one image. They see double only when both eyes are open. So that binocular double vision or binocular diplopia tells me there's something going on neurologically. So that's just one example of the ways MS can affect single vision and create that double vision issue. So a third thing that I sometimes see in patients with MS is that they can develop involuntary eye movements. We call this nystagmus. So for example, the eyes might start jerking in one direction or the other direction, sometimes in a circle. When a patient with MS has nystagmus, they will experience movement of their visual world. So I think of in the old days with the old handheld cameras, you would watch a video and the whole, like the birthday party from when we were kids, and the image is shaking like crazy. I can't even watch that. So imagine someone with MS whose eyes are shaking voluntarily. Their world is shaking constantly, and so that nystagmus leads to something we call oscillopsia, which is very disturbing for MS patients. So yet a third type of MS-related visual symptom. So as I mentioned, with MS-related symptoms, including visual symptoms, often the symptom does get better. So in an MS attack or exacerbation, you have the symptom develop and then it usually gets better. But I have to be honest and say that it doesn't always recover 100%. So patients can have residual visual issues. Really, one of the big messages I would say in being aware of these things is for our patients to know if they have a visual issue like this, they need to let their healthcare provider know, because a healthcare provider might be able to, let's say, prescribe steroids or other treatments to speed up the recovery of that attack. That's important. But also it may have implications in terms of our MS treatment options. So since, as we know, we have many different treatment options for MS, if a patient with MS is on a treatment and develops a new visual symptom, I would say, wait a minute, I have to address the visual symptom, of course, but it may also mean I may need to consider a different treatment option. So in terms of treating those symptoms, there's not something specific for the visual issue. It's really, well, how do we treat an MS attack in general? We think that MS attacks are caused by inflammation in the brain or brainstem or spinal cord or optic nerves, for example. And so our treatments are usually geared to speed up that recovery. So patients may take, for instance, corticosteroids as an example of a medicine that we may use. It doesn't really treat the disease in terms of long-term treatment of MS. That would be a different category, MS treatment options. But steroid treatment can be used to try to speed up the recovery from any MS-related symptom, including a visual one. When my patients ask me about, well, specifically, what do I do about the symptom I'm having? So, for instance, let's say optic neuritis, a blurring of vision. If that doesn't improve 100%, we'll do everything we can to optimize the vision. That might mean visiting your optometrist. You might need an updated prescription or contact lens thing. To be clear, glasses cannot fix the vision loss of optic neuritis, but it can optimize the vision so that you can get the most out of it. Let's say somebody has double vision, so their eyes had some misalignment, it got better, but not 100%, or maybe if they move too quickly, they'll get a little bit of double vision. We have other tricks that we could do, again, using our ophthalmology or optometry colleagues. For instance, some patients may benefit from prisms in the glasses to help straighten out the eyes, and that can sometimes take care of the double vision. On the other hand, let's say we're talking about the nystagmus, the shaking of the eyes symptom. That's something that, I'll be honest, glasses often cannot help, but we do have other medications, other tools, usually pills, that can sometimes help reduce the shaking of the eyes. And there's many different kinds of medicines that we use for that. So really, again, the key is communication. If my patient can let me know the symptom they're experiencing, I might be able to come up with something to try to help with that. One thing I'd like people watching this video to remember, if we're talking specifically about visual issues, is how important vision is to us as humans, which means that for many people, a visual symptom is the first inkling that something is going on. So I urge people, whether they are newly diagnosed or have had MS for a long time to recognize if they're having issues with blurring of vision or double vision or shaking of their eyes, and make sure that they communicate with the healthcare providers so that we can make sure they're getting the treatments that they require and maybe considering other MS treatment options.